Hello, I'm Jim Roberts. I'm host of Senior Living in Alexandria. This is a monthly program put on by Senior Services of Alexandria. In this program, we try to relate information that for seniors, their opportunities, issues, so forth. But in addition, we try to have information that's of appeal to family, friends, service providers, caregivers, those in the Alexandria community and elsewhere. We have a special guest today. This is Natalie Talis. She's with the City of Alexandria Department of Health. She's a planner, and this means that she takes assorted pieces of information, puts them into a pattern, and then puts them into use in terms of the Alexandria community. She doesn't specifically serve seniors, but she's got a perspective for us today on a special project that she's been working on. This is the Community Health Survey that's been ongoing. And Natalie, I'm glad to have you here and eager to hear about a little bit about the health survey that you're working on. Tell me a little bit about your background. How did you get to the health department and what brings you to this survey? How did you get started?
Sure. So in my current role as the public health planner at the Alexandria Health Department, my role is really to work directly with our community partners. Mm-hmm. So that could include other government agencies, faith-based organizations, nonprofits, community members themselves to identify what are the needs of our community around health and how can we work collaboratively to address that. And I feel very grateful to be in this role. I've been in Alexandria as a resident for almost 4 years now and have been at the health department a little under a year. I came from a communications background and also working directly in policy issues around health.
Sounds like you're in a good place with your skills. So tell me a little bit about, so your responsibilities are, you're the chief administrator, planner, et cetera, of, I mentioned the Community Health Survey. What's its purpose, its origins, its status? Tell me as much as you can about the Community Health Survey.
Absolutely. So the Community Health Survey is really one part of this larger initiative we're doing called the Community Health Assessment, or CHA as we call it. And essentially we use this community health assessment to identify what are those really key top health issues in our community. And we do that in a few ways, but the survey is one portion where we ask the community directly, what do you see as the top issues, the strengths of our community, and where are those areas for improvement? And what's great is that we use a combination of those survey results in addition to a lot of statistical analysis. So we have our epidemiologists back at the health department that are sorting through hundreds of other ways of looking at health. So for example, how many people in our city have asthma? How many people suffer from diabetes? But also some things that are not quite what people think about in terms of health. So for example, how many people struggle to pay their rent every month? How many people struggle with food insecurity? Do people have access to safe places to play and go outside in green space? So we're really looking at all of those things for a holistic picture of what health looks like in our community.
What's the origins or the history of it? Is this the first time this has been done?
So community health assessments have been done across the country in a lot of different health departments. It's also something that a number of nonprofit hospitals do as part of their IRS status. So we're actually working really closely with the ANOVA health system on this work. So that way we're not duplicating efforts. We're looking together for a picture from both the healthcare side as well as the public health side about what's important to our community. So what's really neat and something that's kind of unique in our state actually is that we're working regionally. So in addition to the things that we're looking at within Alexandria and our specific community, we're partnering with Prince William, Fairfax, and Loudoun counties so that we all have the same methods of what we're doing. That way we can see, you know, once we're done at the end of the day, can we look across all of our region and say, are there 1 to 2 things that we can work on together? Maybe there are some regional issues that all of us are dealing with that we can make a dent together.
So I'm not clear. Is this the first time this has been done in Alexandria, or was it done every 5 years, every 10 years, never before?
So this is the first time that we're doing it in this way, this really large-scale way. The health department has done past versions of this. I think the most recent one was quite a number of years ago. But this is the first time it's ever been done with regional partners. It's also the first time that we've ever worked directly with a health system to do this work. We're also taking it on at a larger scale. So we're really getting more active in the community directly. So rather than just relying on one method of hearing from the community, we're being really intentional about hearing from as many Alexandrians as possible and meeting them where they are. So not just saying, come to us when you have a minute, but going to their backyards, going where it's convenient for them to make sure their voices are heard.
Is this comparable to the census of population in terms of broad 100% coverage, or are you sampling or relying on, or both?
Yeah.
You sound like you're pretty comprehensive.
Well, we would love to be as comprehensive as the survey, but unfortunately we do not have that kind of manpower to do that. So we are doing some sampling. So for example, our survey that we did, we heard from a little over 1,800 residents, or we consider community members. So people who either live, work, or play in Alexandria. So maybe it's people who work in Alexandria but live in Arlington, or people who live here and work here. So all kinds of people who we consider community members. So we ultimately reached about over 1,800 of them for specifically the survey. However, when we look at the data side of the equation, that's when we can really get a more comprehensive picture. So looking at our overall statistics.
Where are you, when did you start, and are you complete with this now, or where are you in terms of, are you midstream?
Yeah, so we had our survey out in the field in the fall. So our survey was out in September and October of this past year. And so we closed the survey at the end of October. We did the analysis over the next few months. And we have those survey results that I'm happy to share a little bit about those with you. And then just recently, we've completed all our other analyses also. And really the biggest part was then putting everything together to get our top list of issues. And we'll be releasing that in a few months.
Will you be issuing a report, a series of reports available online, et cetera? How will, when you get done, how will people know about this?
Yeah, so at the end of June, on June 26th, we will be releasing a report that summarizes this whole process. It's been a fairly, actually, it is not, surprisingly. It was a very intentional decision with me and our leadership, our health director, Dr. Herring. We've been really intentional about, we don't want some big 300-page document that no one's going to be able to read, that you need a PhD and a JD to be able to comprehend. We don't want that. We're being really intentional about, we want a very manageable report, maybe 25 pages at most, but something that anyone in our community can pick up and understand, oh, these are the top issues in my community. So I understand that, and then what happens next, right? What do we do with this information? Because we don't want people to think that, yeah, you heard from me in this survey, you collected all this data, now it's just going into some back shelf at the health department to never see the light of day again. We really want this to be something accessible and actionable, too.
Okay. We have to go to a break,
Sure.
but you've raised so many interesting questions. When we come back, I want to know what some of those findings are and a little more detail of what you're going to do with it. But we're going to go for a short break, but we'll be back. Well, here we are again with a wonderful cooking segment that we want to add to our program this month. And I'm pleased I'm here with, well, my boss, Madison Reeder, and I'm her assistant.
I wanted to make a really simple, nutritious, sweet treat that's great to take with you to barbecues, family events, and that takes under 15 minutes to pull together.
Sweet and 15 minutes, and
Yes.
We can't go wrong.
Exactly.
So what is it?
So we're going to make a berry salad with a twist.
Berry salad with a twist.
Yes. So
I like it.
I think you're going to like
Let's
this
get
one.
started.
It's very easy.
What are we going to do?
So we're going to grab a big bowl, and it's all made in just one big bowl here. So
Okay.
the first thing we're going to do is we're going to add 3 ounces of a pudding mix. So I used this.
Let me add, what's in there?
So some gelatin. Try to.
No, I mean here.
In
What-
here, this is our pudding mix.
Oh, it is.
Yes,
I see.
sir,
I'm sorry.
yes.
It looked like I'm okay.
It looks
Pudding
like
mix.
something fancy, but all it is this pudding mix right here.
Jello pudding mix. All right.
Yes.
Lemon flavor.
I used a vanilla flavor,
vanilla,
actually.
okay.
Yes, a vanilla flavor. You could use really any flavor you want. So whatever you're feeling, whatever kind of refreshing treat you want.
Vanilla's going to be great.
I think it's going to be
great,
great
okay.
too. So we added some vanilla in here. I used a sugar-free and a fat-free version, which is
I
great
see.
for anybody who's diabetic or watching their cardiac health. So we just threw about 3 ounces in here. So some of the packets are bigger and they have that full 3 ounces.
Okay.
I added a couple different packets there. So that's really our base. Then the next thing we're going to add is some Greek yogurt. Now we've worked with this before.
Oh, yes.
And Greek yogurt has a great amount of healthy protein in it. So what this is going to do is going to make this a nice filling snack for us that's got some great
Okay.
nutrition. So we're going to add this into
The whole thing?
here. We're going to add about 12 ounces.
Okay.
12 ounces.
Greek yogurt. Not just plain old, garden variety yogurt, but Greek.
Yes, just
A little
because
thicker, a little more
Exactly.
nutrients.
Exactly.
I mean, this is,
That's exactly right. So we
Okay.
are going to just mix that up, and you can see the color change happen
yeah, look at
because
that.
pudding is having a reaction with that Greek yogurt. So we're just
Yeah.
going to toss
you
that
could
all
just eat
together.
that alone, and
You
it would
certainly
be good.
could.
But not us.
No, we're going to take it one step.
Cheesecake and salad in the same recipe?
Hey, I'm all for that. What
All
do you
right.
think?
All right. Well, I'm eager.
So the next thing we're going to do is we're going to
Oh,
add
Cool
about
Whip.
12 ounces of some kind of a Cool Whip or a whipped topping.
Okay.
I chose this coconut flavored one
Oh,
because I
look
thought
at
with
that.
the vanilla it would be a really nice flavor combination. So we're going to add just about this whole container here, just
Yeah.
using the same old spatula since it's all getting used
going
and
to the
mixed
same place.
together. Yes. And this coconut one is pretty low in calories as well. So even though we're adding lots of really great flavors,
Mm-hmm.
not a whole lot of calories.
Okay.
So that's great for a sweet treat, right?
Yeah. Even before the berries.
Yes,
Looks
even
good.
before the
It
berries.
smells good. It smells good.
Yes. So with that Greek yogurt, if I just used a plain one, again, to cut back on the calories
Yeah.
and a lot of the sugars, a lot of the Greek yogurts that have all the sugars added
Yeah.
to them, they're delicious, but they can really wreak havoc on your blood sugar if
Well,
you're
and
diabetic.
you might get into flavor conflict between the vanilla
Exactly.
and the coconut and the lemon.
Exactly.
Which we can't do that.
Yes.
Oh, look at that.
So see, we've got a nice, fluffy, very fluffy consistency going on here.
Cheesecakey.
Yes, exactly, exactly.
All right.
The next thing we're going to do is we are going to toss in our berries, and we're going to make sure we fold them in very gently so we don't squish them too much. So we've got some blueberries. Do you want to add those for me?
All of them?
Yes, sir. All of them.
There we go. Oh, look at that. Ooh.
Perfect. And we will fold those in, again, very gently folding them in so we're
Wow.
not squishing them. You always want to make sure that you're washing your berries to rinse off any
Right.
dirt, any
Understand.
pesticides. But you want to make sure with berries especially, you're only washing them right before you use them. Otherwise, they absorb all that water and it can be they can get pretty mushy a little bit too
We,
early
of course,
on.
did that.
Yes, we did.
Yes, we did.
Absolutely.
All right.
Next, we're going to add some blackberries and some raspberries.
Blackberries, raspberries. All of them?
Yes, all of them.
Ooh.
We want the most nutrition out of this as we can, right?
Yeah, you said not to mush them, so.
Exactly. So we're going to fold
All right.
very
Oh, look at
gently.
that. Oh.
And it's just the nicest color. And with Memorial Day coming up, 4th of July coming up, this is the perfect
Are you
simple
sure
salad.
this is a salad and not a dessert? It looks awfully good.
Well, let's call it a dessert salad. I
Okay,
think that
dessert.
that's,
Oh, that's a nice
I like
concept.
that. As a
Dessert
dietitian,
salad.
I'm all for that, right?
Yeah.
And then the last thing we're going to add, we are going to
More?
add, yes, we're going to add some strawberries in there.
Oh,
so
my.
again, making sure, especially with strawberries, that you're washing them beforehand.
Mm-hmm.
Just got these ones from the store. A lot of times you can find these pre-cut as well. So for my seniors who are having a little bit of difficulty cutting, look for these pre-cut. So we're going to
Pre-cut.
just
Oh, my
toss
goodness.
them in. Pre-cut, we have them washed. And just do just about all of them there.
Okay.
And then we'll toss those as well. And all of our berries, anything that's really brightly colored in nutrition, you can usually assume that it packs a very nutritious punch. So with our berries, they're really rich in antioxidants. And I feel like that's been a buzzword of the year, but antioxidants help to prevent and fight disease and illness, whether it's joint pain, cancer, you name it. So the more berries, the better.
Are berries gluten-free, just out of curiosity?
They are gluten-free, yeah. So these are a good option for...
I saw a magazine cover, it said it was gluten-free gluten.
Oh.
That's coming next.
Well, hey, we'll have to look at that for next time. What do you think?
Exactly.
And then that's all there is to it. You can serve it immediately, chill it for up to 3 days, but it's best when it's served right away.
No, that's wonderful.
And it's just got such a nice color to it, nice texture.
You could have some kind of nice small cookie or eat it straight.
Yes,
or,
some granola, make it a breakfast.
Eat it alone. I mean,
exactly.
Oh, granola would be great.
Yes, and then if you wanted to, you could add a little bit of sweetener on top if you felt like you needed a little something more.
Know.
But I
Boy.
think this will be good just the way we have it. So would you like to give it a try?
What do you think? Here, have a spoon.
All right, let's give it a try here.
Oh, my.
Make sure you get some fruit in there.
I know it. It's hard not to, but all right, here we go. You've done it again.
I've done it again.
Yep.
Well, thank you very much.
That is good.
Thank you. Very simple.
That's refreshing.
Very refreshing, yes.
That's very nice. I'm not sure.
You have to try it again, yes.
There we go. Pardon
Make sure,
me.
I see you trying to miss out on those fruits there. Make sure you get those.
It's hard. You can see there's a lot of fruit in there. Okay.
Well, I'm glad you enjoy it, and thank you so much for having me back again for another month.
Try this. Try it at home. You can try this at home. Thank you very much.
You're
That's very, very
welcome.
good. We're back. I'm here with Natalie Talis. She's a planner with the City of Alexandria Health Department. We've been talking about the community health survey she's been working on for some time and learned a lot about where it came from. But now we want to get into some of the results and what you're going to do with it. So Natalie, without further ado, what have you learned? What are some of the conclusions so far?
Yeah, so there are a few main takeaways that we got from the survey, and really also as it relates to seniors in our community, we had a great number of seniors actually respond to the survey.
Okay.
So, we had more than 1,800 people respond to the survey overall, but from that we had probably over about 680 seniors, so folks over 50 who took the survey. And so we're really able to get a good representation about what people over that age in our community are looking for and what their thoughts were and how maybe it differs from the general population. But overall in our community, so we asked 3 questions. We asked, what do you see as the strengths of our community? And overwhelmingly, people said a lot of the same things. So they said that they really appreciated that we have educational opportunities in our community. They appreciated our diversity in Alexandria. And they also loved that there were opportunities to be involved, which is something that I see all the time, that there are so many strengths of that. Also, when we asked about what are the top health issues in our community, the results were really clear.
That was the second question.
That was the second question. That's right.
Okay.
Mental health was far and away the top answer through almost every demographic that we analyzed, through almost every age group, almost every zip code. Mental health was near the top of the list for them.
As a problem?
As a top health issue.
Interesting. Okay.
Yeah. We also saw that community members really cared about each other. So, for example, one of the options under what are our top health issues, it was there are different health outcomes for different groups of people. So really getting at health disparities or inequities in our community, which is something that the data itself tells us exists, because overall Alexandria is a pretty darn healthy place. But when you start parsing
Physically
things
healthy
out,
or mentally healthy or both?
all over. So
Okay.
we're generally pretty healthy.
Yeah.
But when you start looking further and deeper down into the data, you see really big disparities in our community. So for example, when you look by zip code or census tract, you see that within Alexandria, there's an 8-year gap in life expectancy depending
Really?
on where you live.
Wow.
Which
Okay.
is really shocking.
That's amazing.
There's also disparities when it comes to accessing healthcare. There are disparities in terms of, how likely you are to have some of these health conditions like diabetes and all those other things. How often you're going to be hospitalized because of those issues. Whether you can access fresh fruits and vegetables, all those things, we have some pretty significant disparities. And we saw that based on also in the survey results, we looked at it by zip code and how people responded. And that's where we saw some of those differences too. So for example, in some areas, people listed dental problems as one of the top health issues in our community. But overall, when we looked at the people who are over age 50 who responded, it mostly tracked with overall results, except that they selected more often age-friendly issues, which is not a terrible surprise if they're in that age group. We also saw obesity come up. We saw alcohol, tobacco, and substance use come up as issues as well. And then when we asked people the final question of the survey of what would most improve your quality of life, the number one answer across every single demographic, every single zip code was affordable housing. Number one, hands down, almost every single income bracket too, which was really interesting. Affordable housing was the number one response of what would most improve people's quality of life.
Did you happen to track homeowners versus renters or newly arrived? We've lived in Alexandria for a number of years. We could not afford to move into Alexandria now, having been there. When they say affordable housing, is that people that are trying to upgrade their housing or buy a house rather than rent? Is there any number on that? Why affordable housing? That's kind of a surprise given what you found as the disparities.
Unfortunately, we don't have kind of the why behind some of that and really getting into why did people answer this way. And the way that we're trying to get to the bottom of some of those questions is through other deeper conversations. So we've had a few public community meetings where we really try to engage people directly about why do you think people answered this way? How do you think people respond? Really getting to the heart of some things that we wouldn't normally guess, at the health department, but hearing directly from community members about why they selected certain things. So, for example, one of the things that would improve quality of life too was selected as more educational opportunities. So people selected it both as a strength, but also as an opportunity for improvement.
Was that identifiable by the school-age population or across all populations?
Well, it was across all populations, which is interesting.
2/3 or a third being seniors.
Right.
Okay.
And so that could be libraries, right? It doesn't necessarily mean our higher ed or K through 12. It could be the fact that, libraries across the city are not all the same, depending on where you live.
Two questions at the same. One is, what are you going to do with all this? And number two, what particularly relates to seniors?
Sure. So all of this information, so as I mentioned, we're going to be releasing a report in June with these top health issues.
Okay.
But this is going to be about a list of 10 top health issues, which, the health department would love to fix all of the issues,
right.
but we do not have the capacity. So really what we're going to be focusing on after the June report release is working with our partners, such as the Partnership for a Healthier Alexandria, along with senior services, along with faith-based organizations, nonprofits, all of them to come together and reach out to the community as well to help us narrow down that list into a top few priority issues about what should we really focus on, so we can build a 6-year plan to address those things in a really meaningful way. And it may not necessarily be what we traditionally think of health, right? It may be something around housing. It may be something around economic stability. It just depends what the community is asking for. So that's part of why we just need to keep reaching out and hearing what the community has to say about it.
Will that be, so it sounds like a report, community meetings. Are there other means of trying to get the word out to the community? Newspapers, I suppose, articles, feature articles. Okay.
Yeah, absolutely. We're trying to reach out to as many people as possible. We were really grateful to Senior Services for their help in getting the survey out to the community. There's a reason that we had so many seniors participating in this survey, and it's because we really were so lucky to have these partnerships. So for example, we had envelopes made up of pre-addressed envelopes back to the health department, and we put those envelopes with the survey into Meals on Wheels bags.
Oh, great.
So
okay, good idea.
people who are at home can still participate in this survey. We also were able to share it with the Senior Ambassadors Program and have the information at the stands that Senior Services maintains at rec departments. So really just trying to reach out in as many ways possible, because you know, we really do want to hear from the community. We don't want this to be a decision that just the health department is making. So we'll be posting stuff online, things in newspapers, on social media, as many places as possible, because this is really important.
We're out of time, but I feel gifted to have received this preview of saying, I wanted to learn about this because I think it's important for our community and the thorough look you're taking of the community, but we also need to listen to you and your colleagues and the organizations when you get done and see what we can do to make it a better Alexandria. So thank you very much for coming in and sharing that with us. Appreciate it very much.
Thanks for having me.
Thanks, Natalie. Yeah, take care.